All right, guys, so a little take two because I messed up the first take on this, but wanted to take just a few minutes to talk about different options when we talk about abdominal contouring procedures. So one of the biggest questions I get from a lot of patients that I see in consultation here in San Antonio is, am I a candidate for a mini tummy tuck or do I need a full abdominoplasty? And so one of the biggest defining factors for mini versus a full tummy tuck is whether or not there's any laxity above the level of the belly button or the umbilicus in this case. If there is laxity from the skin perspective above the umbilicus, that cannot be addressed with a mini abdominoplasty. So a mini abdominoplasty is simply a smaller version of a full tummy tuck or a full abdominoplasty. It allows us to remove excess skin and soft tissue infra-umbilically, so meaning below the level of the belly button. And it's also for those individuals, women or men, who simply have just a tiny little pinch underneath that belly button, because as you can see, it's a shorter incision, or it tends to be a shorter incision. If we have any excess soft tissue out here laterally along the flanks or those love handles, it would simply bunch if we try to pull from the infraumbilical superior aspect of the incision to the infraumbilical inferior aspect of our isolated incision. So you could see this is really meant for an individual who has very minimal excess soft tissue along the flanks. Additionally, a mini tuck, although we can raise the mons a little bit and do a little mons plasty and pick it back up where it's supposed to be, this is meant to only address things that are below the belly button, and it does not allow us to do a diastasis repair, which is that separation of those core muscles, those rectus muscles that takes place in our post-pregnant women. So in order for us to address the diastasis, we really need to do a full abdominoplasty. You can see that the area outlined in red here is our dissection zone. So that means that is the area in which we have fully elevated that soft tissue off the abdominal musculature. You can see in a full abdominoplasty, we have a pretty excessive amount of dissection that takes place all the way to the level of umbilicus. And then above the umbilicus, we create a beautiful little short tunnel in order to allow us to repair that diastasis and bring those muscles back to the midline and restore that core strength. So some of the big differences: full abdominoplasty, we can do a complete muscle repair, we can remove all excess skin, so both supraumbilically and infraumbilically. We can also do that monsplasty and pick up that pubis where we need to put it, and it also allows us to retranslocate the belly button to the correct location. In a mini abdominoplasty, we are only able to remove the excess skin, really that tiny little pinch from below the belly button, just above the mons. We are still able to do that monsplasty or that pubic lift, but we are not able to do a diastasis repair in a mini tummy tuck. Hope that cleared up some questions. See ya. Bye.